Well, thank you all for coming to this meeting. We're holding a series of webinar where we're applying for different residencies, and in particular, this one is to applying to the CT Integrated / Fellowship panel. The way this meeting will go, the first 5 to 10 minutes, we'll give a brief introduction of our panelists, how they got to where they are, with the follow-up 20 to 30-minute question that we have prepared. And then the rest will be Q&A from with the questions that you guys all have submitted, and you all can submit also on this chat. And before we get started, I'll introduce myself. My name is Philip Hong. I'm a third-year medical student at the University of Florida College of Medicine, as well as the South Regional GSSA representative. And
my name is Liza Hill. I'm a second-year medical student at the University of Arkansas for Medical Sciences, and I am the UAMS GSSA chapter president.
Perfect. And without further ado, introducing our panelists. With first, Johann Lin Md, MPH. Yihan is a PGY-9 Cardiothoracic Surgery Fellow at the University of Colorado. She's a former Paul Farmer Global Surgery Fellow and the World Health Organization intern. She spent several years working and living in Rwanda and Zambia, and her research focus is increasing surgical access in underserved populations. Now, Clauden Lewis, MD, MS. Clauden is a PGY-5 Cardiothoracic Surgery Resident at University of Rochester, 6-year integrated program, graduate of Medical School, Howard University, and the Secretary and Chair of Communications at the Thoracic Surgery Residents Association. He has profound interest in ethics and global health, with trips focused on congenital and adult heart surgery in Ecuador with Nove Cardiac Alliance, and Dominican Republic with CardioStart as research coordinator and surgeon assist, as well as international talks in Colombia regarding hereditary cardiac disease. He is a recipient of the TSRA Global Health Scholarship, which will fund trips to both Tanzania and Brazil. And before we dive into tonight's topic, I wanted to start off with a general question, especially as the idea of mentorship and guidance is incredibly important in the field of global surgery. So what is the most memorable advice you both have ever received from a mentor?
I guess I'll let Yihan take this.
All right. Well, thanks everyone for being here, and feel free, after the session, if you have any questions, to email me as well. I think, when we're talking about surgery and global surgery, the most important thing that I learned is that, I think cardiothoracic surgery is a field that requires a lot of precision and practice. And so when I started off as a medical student, I was very concerned about finding a fellowship that was very global health friendly. And as Clauden will probably tell you, those are few and far between. And I think our first responsibility as surgeons is to really be the best at our craft possible. And so when I was considering fellowships, certainly, global health mentorship was important to me, but I think what was even more important was to make sure that I had the best possible cardiothoracic surgery training, because I think if you're a great cardiothoracic surgeon, you will find a good global health spot for yourself. And you shouldn't, make any sacrifices for your training, because this is just a profession that has such a small margin of error that I think, compared to any other specialty, it's very important that that you consider that when you're looking at different places to apply for.
All right, I guess I echo what Yihan says. Thank you guys for having me. Overall, in regards to memorable advice that a mentor has given me, following one of my most recent trips that I went on with Dr. Maroth in the Dominican Republic, he and another surgeon, Dr. William Wilson, told me it's absolutely worth it, keep going. And I take those words of advice for the many different things that I have done in regards to seeking global health. As we'll discuss a little bit further, the Integrated Cardiothoracic Surgery Fellowship, or residency, so to speak, do not have a long track record, as they haven't been around prior to 10 years. It's a newer paradigm of training. Therefore, a lot of the things that we are doing, we're kind of trailblazers. We're starting opportunities that not many people prior have been able to do, but definitely paving the path for people after me. So having said that, there wasn't a global health niche or opportunity per se, but I have had the support of the attendings at my local institution. And as I was told by the advice of my mentors, to keep going and pursue it. So I have made opportunities to get myself there. And we could talk about it further.
Absolutely. Thank you both for sharing. And before we start the next question, Yihan, there's a little bit of mic feedback that I'm receiving when you do speak.
Okay.
However, I'll ask the follow-up question and Clauden can answer. And if there's another adjustment that you can do for the mic, but if not, we can still hear you perfectly clearly as well. So there's not too big of a worry. Now, as a question, as an introduction, can you talk about your global surgery experience / background in medical school and what your involvement looks like now as residents, including any specific research you're working on or any partnerships you currently have? And Clauden, if you want to take that one.
Yeah. So I went straight through from medical school into Integrated Cardiothoracic Surgery program. It's a 6-year training program. I took off no research years, so straight 4 years of medical school match and then get into the 6-year training program. So it should be a total of 10 years post-baccalaureate, but I also have a master's. Having said that, I didn't do global health trips in this field in medical school. My parents are from the island of Haiti, so I've been able to kind of give back in that regard on a couple of trips. Having said that, as it pertains to service in health, specifically cardiothoracic surgery, that started my 2nd year in cardiothoracic surgery training. You know, the training is very difficult. It's a steep learning curve, especially coming out of medical school, but I knew that it was a passion for me. So I used actually one of my vacations. We get 1 week vacations for total for the year. And I used a week of my vacation to actually do some traveling. So I went to the Hospital del Nino in Guayaquil, Ecuador, with congenital heart surgeon, Dr. Cardarelli. And it was a great opportunity, great experience. I loved every bit of it. From helping to doing operations to seeing the families, both pre-op, post-op, and essentially helping the infrastructure with their programming. The goal is essentially to create autonomous surgeons there, because some of the actual surgeries that were being done, the local surgeons are not able to do based on their experience. So the goal is to bring experts over and create an autonomous opportunity for them so that when the team leaves, they're able to sustain that practice. And every specialty was filled. That means, you know, ICU nurses volunteer, young residents like myself volunteer, different individuals such as cardiothoracic surgery intensivists. So those are the ICU doctors who run the unit. They all had opportunities to kind of chip in and help out. And it was a great experience, but that was during the beginning parts of my surgical training.
Can you guys hear me a little bit better? Is the feedback a little bit better now?
Yes.
Okay, great. Yeah, so I actually did a little bit different path from Clauden. I started medical school a few years before he did, and actually the integrated program was very new at the time, and there was no research years that were offered. And it was very important that I do global health as part of as residency. So I actually decided not to do any of the integrated programs, which were 6 years with no research time, and decided to do general surgery, where I would have an opportunity to pursue some of my global health interests. And so for the 2 years, I did quite a few trips as a medical student, but there's, I think, a limited offering that you can do without a real degree. And so as a resident, I spent 2 of my research years working in Zambia and Rwanda. I actually joined the Whole Pharma Global Surgery Fellowship, which is out of Harvard Medical School. And there are a few now, you can probably count them on the palm of one hand, but There are a few global surgery specific research fellowships for surgical residents. I think those are very important if you're really looking to develop your skills as a public health advocate. It just gives you a lot of protected time to be able to learn the lingo and learn how to interact with public health professionals in this field. And so with this fellowship, I worked with several members of the Ministry of Health in both countries to basically increase surgical access in the more rural areas. In places like Rwanda, for example, a lot of the surgery is focused just in the city. And so very basic things like safe obstetric surgeries and C-sections, or easy hernias, for example, orthopedic fractures, those things cannot be really taken care of in a more rural level 1 hospital, which should be the case. And so, we worked with the Ministry of Health to develop a 5-year plan to increase surgical care in these level 1 hospitals throughout the country. And obviously these things don't happen overnight. So again, it's a very long, reiterative process that you'll have to go through. So since then, I've been also then back to Rwanda ever since. There's a group called Team Heart that's been going for the last decade. And they just trained their first cardiothoracic surgeon for the country as well. So I think there's many ways to engage. During my time at Harvard, I also got a public health degree, I think, again, to just make sure that I understood a little bit more about how this public health realm works, because it's quite different from how we as medical professionals, and then especially, we as surgeons think. So I think there are a lot of opportunities that you can get yourself involved in. You can do, one-time trips, volunteer trips. You can actually spend dedicated research time. And all these opportunities are out there and available for, people that are specifically interested in surgery. So I think it's a very new and exciting time, because as a medical student, I didn't have any of these opportunities. And now, we are creating opportunities for medical students and residents to be able to participate, in things like grants, and all those are all possible now. So definitely a doable thing for someone interested in surgery.
And going up to the follow-up question of where we ask, what did you find the most important when looking at residencies, and how strongly did you consider your support for global surgery when choosing a program? Because it sounds like for both of you guys, for Clauden, more like you didn't start doing the global health until your second year PGY2, and Yihan, it kind of looks like you had more of an intense focus when you started your residency instead of starting intensely in medical school. So did you guys have global health in the back of your mind, or is it something you guys kind of just faced as you guys entered your programs?
Yeah, and I can, I guess, follow up on what I sort of talked about in the beginning. I think as a medical student, talking about global health and having been on a few trips, and then interviewing for surgical programs, which traditionally, I think, do not prioritize global health. It was a bit of a difficult climb to say, I'm interested in global surgery. This is what I want to do in the future, because there weren't any examples of people that had done it sustainably and were able to integrate it into their practice early on. A lot of our mentors that are doing global health are at the very end of their careers, where, maybe they're the chair of the department and they get to make all the decisions they want. But we don't really have as many young surgeons that are able to do this. So I think going into residency and actually spending 2 dedicated years where I was, actually doing global health and also being productive in terms of, publications and policy documents and things like that, that really legitimized my interest in global health. So I think it was very important to have it all the way through, because when I foresee my future, asking for a job as an attending, I now have a lot of history and background to say this is something that I truly feel is important for my career. And it's not just an interest or a passion, but it's an actual career path that has shown, productivity and impact. So I do think it's important to stay engaged the whole time. I will say that I still stick by my original point that as a cardiothoracic surgeon, you only have, 3 additional for me, including my 7 general surgery to train, and then for Clauden, 6 years to train. And it's a very difficult specialty, and you want to come out knowing that you're the best. And so I think that should be the #1 priority, and you will find opportunities along the way to do global health. So for example, I did my general surgery residency in Colorado, and it's traditionally not a global health, global health isn't emphasized at Colorado. And so for my research time, I specifically left and went to Boston to find mentors and fellowship in order to, get involved in the global surgery field. And so I think you may not necessarily find it in your own institution, but it is important to find mentors that are willing to support you. So for example, when I went to Harvard, I had a few faculty that were willing to back me and give me a little bit of a stipend so that I could then go out to Boston and find my own grants for the remainder of the 2 years. And so having good mentorship doesn't always mean having good global health mentorship. And I think, again, cardiothoracic programs there are just such a huge variety of quality of programs and how good of a training you get, that I think it's important, for all of you guys to know that it's a very different way to think about it, when you're trying to select a program.
I guess I'll take that question next. In regards to global health, experience when looking at residencies, there is a diversity of individuals in global health, as also there is a diversity of training programs that trains the cardiothoracic surgery resident and fellow. What I would say is for the integrated cardiothoracic surgery specialty, as Yihan noted, she started medical school before me, and her surgical training before I did. And during her time, there was less cardiothoracic surgery integrated positions. That still remains to be true. When I matched into cardiothoracic surgery integrated fellowship or residency, they still call it, that was in 2016. There was 27 programs, and each program took one person, one human being. 3 programs took 2. So the positions were very, very limited. And if you think about a national body of individuals who are interested in cardiothoracic surgery, and then also add in international audience who are also looking for a categorical position, not to mention osteopathic physicians who are applying as well, you have a robust amount of applicants for essentially one person that hospital is going to match for that year. And I say that to say matching is already difficult. To kind of control the global health experience of the place that you intend to get accepted to is also going to be limited, as the seats are very, very small. And that's very different for general surgery, which I also did apply to. I interviewed at maybe 12 or 13 general surgery positions, and that was going to be the route to cardiothoracic surgery. But at the time, there was maybe 250 programs, and each program took somewhere between 3 to 9 people. The amount of seats for general surgery is very, very different. In fact, I think it is feasible to say, hey, I want to be at this specific program that has this global health perspective. Perhaps Harvard has some strong traditions there. University of Miami, where I was kind of born, in Miami, Florida, they actually have some global health opportunities. Had I matched in general surgery and had I matched there, I would have strongly considered it. My route is by way of University of Rochester Medical Center, where I've had the privilege of having the support of the faculty here to take time off to more than once do about a week trip. That also means that for programs that have individuals who are interested in doing these opportunities, let's say they're 2 weeks long, it isn't feasible for me. And I found that to be what I wanted. That was the balance in which I wanted. 6 years of cardiothoracic surgery focused training, and then I essentially get out as an established cardiothoracic surgeon, get my hands where it needs to be, and I can jump right into the grind and help where help is needed. That to me was the opportunity in which I sought. I know that cardiothoracic surgery is very, very, very difficult subspecialty. And for me, I think the focus of the 6-year program is kind of what I originally wanted. Had it not worked out, there was backup plans, of course. But I say that to say, as we discuss a little bit further, the integrated specialties are very, very different in regards of number of opportunities to be a part of it. And I say that to say the body of cardiothoracic surgery training is diverse, but the responsibilities remain the same. They're seeking the best and the brightest. They're seeking all-stars who are going to come in and work very, very hard. Every single step that you do on a patient is a life-threatening maneuver, to be completely honest. So when you go overseas and you do that same procedure on a patient, you know, they need to understand that you are operating with their needs at the helm, and they are the most important thing that you are taking care of at the time. And for me, what I want to do when I'm established, I want to give back free operations and some of these complex operations. And I find that by focusing on my training and then going out and then being in that environment is fulfilling for me. So it fit best for me to do this route. So you guys are getting an opportunity to see the different perspectives of global health and how it's ingratiated our subspecialty and how we in the future will be volunteering our time.
And can you guys give an overview of how research time looks like in your subspecialty and the most common ways people use? And this has already been slightly touched upon, but if we can go into it further, such as having a short-term, long-term, or Yihan, as you have mentioned, different programs such as masters and fellowships.
I guess I'll quickly mention in regards to research time. In our cardiothoracic surgery training program, what's true in the nation is that it's variable. There are programs that actually require and make mandatory research time. For instance, I can think of Stanford, where they're doing 2 years, sometimes 3 years of dedicated research time. That means it's an integrated 6-year training program, but they're tacking on 2 more years. So when you match there, you're doing 8, possibly even 9 years of cardiothoracic surgery training. We're also an integrated 6-year program with no mandatory research time, but what's true for our group is that we've made it flexible. Should you say, hey, I want a year off, we actually accommodate for that. We've graduated so far 5 residents so far. And of our integrated program, of those 5 residents, 1 did research so far. My current co-fellow, who's also PGY 5, has done 1 year. He's supposed to be a 6, he's a 5 with me now. And our current year 3 is currently out doing research. So that opportunity is available should you like that. I like my life a little bit more, how do I say, stressed. So I am doing research time now. I'm talking to you guys right now. I could be sleeping or I could be doing something else focused on clinical opportunities, but I find that there are 24 hours in a day and I've been able to use those hours wisely. So for me, the opportunity has been great, but that comes with its benefits and that comes with its lack of opportunities. For instance, I'm not doing 1 year or 2 years dedicated in a certain thing. Perhaps that thing could be global health. But for me, the opportunity that I wanted to do is have 1, 2 week, 3 week experiences of doing global health opportunities in regards to cardiothoracic surgery, and then coming back to focus on my training. I get out earlier, I can focus all that time, but when I do focus that time, I'm now using the skills of a board certified cardiothoracic surgeon. And that's just the difference.
Yeah, so I think, again, there are just a lot of different ways to do this and a lot of different time periods in your life that you can do this. You know, think I always get the question from medical students, should I do, for example, a public health degree during medical school, or should I wait till residency? And again, I think there are just a lot of ways that you can integrate research with your clinical time. And I think there are more and more opportunities to be able to do dedicated research in global health. You could easily find a mentor, look at some clinical data, or there are several different surgical societies that actually provide grant funding for you to be able to spend a dedicated year or two focusing on global health research. And I think the key with those is that you have to figure that out early, that you want to do it, because it's always about a year and a half of lag time between them giving you the grant and you starting your research time. And so you have to plan, you have to make a research proposal, you need to find a mentor, and then apply, and then wait a year and a half for your research time to start. So I think this is great that all of you guys are involved in this webinar, because then you just have opportunities to think about it and sort of plan things out to maximize your time. I think it's really difficult to do dedicated research time if you don't have funding and you don't have mentorship. So it's always good to plan ahead. So I'd encourage you to look at, for example, the ACS and the, now I can't remember the surgical society within the general surgery that also has some global surgery opportunities. But in any case, if you guys email me, I can look that up for you guys. So there are a lot of different opportunities. And I think the key is, even if you don't have someone within your program that's doing global health research and you're interested in it, there are people out there that are interested in mentoring, a bright, dedicated, passionate student. So all you need is a little bit of preparation, and you guys will be able to find something for research. And the other thing I will say is that I do think it's very worthwhile, if you want to see this as an academic focus. I think there's different ways to go about doing global health. You could volunteer your time, you could do it as your academic focus, you could teach in these institutions. And if you want this to be an academic focus, it is a good idea to be productive in the field, and so that people will see it as something that you're actually going to integrate within your career, that's sort of separate from one-week trips, because when you go into an academic setting, I think it is a good idea to say, I want dedicated time to do global health, say 4 months out of the year, to have some sort of backing, if this is going to be your research endeavor as well, because I think a lot of academic programs are looking for people that have some sort of research focus. So I think it's a good idea to look at global health as a separate academic track, if that's what you're interested in.
That's a great segue to our next question of, are there any programs in particular that stick out in your mind with dedication to either global CT surgery that you have experienced or heard of? And follow-up is, how as medical students can we best connect with them?
Yeah, I think right now, the best general global surgery fellowship that I know of is the one at Harvard. There's a Paul Farmer Global Surgery Fellowship that I did as a resident, but they also have a dedicated one for medical students. There are also programs at various universities, UCSF, for example, Duke, Vanderbilt, etc. But there's nothing that's quite dedicated to cardiothoracic surgery. I've had actually, I'm very involved in Rwanda. I lived there for quite a while during my research time, a year and a half almost. And so I have 2 medical students from our university that go every year during the summertime. There's usually a block period for our students between the first and second year of medical school. So this year, unfortunately, they couldn't go to Rwanda because of COVID. But they were still working on a bunch of projects that we had, in Rwanda. And so I think, again, as medical students, you can find these opportunities. You just have to sort of look around for mentors. But in terms of dedicated time, if you want something that's a year long, then I think the one at Harvard Medical School is a great one to start off with.
Clauden, you're currently muted.
Probably speak to what's not a dedicated time as far as a year, but those who are interested in volunteering their time, there are a couple of organizations that I've worked with. One being Novick Cardiac Alliance. That was a great opportunity with Dr. Novick and Dr. Cardarelli, who also is one of their volunteer congenital heart surgeons. And then there's also CardioStart International Incorporated, and that's by Dr. Abin Maraf. You know, both organizations have done probably close to 20 years or more of multiple destination surgical opportunities, 1 week, 2 week trips, doing operations from adult cardiac surgery, pediatric heart surgery at multiple hospitals. They're responsible for probably hundreds of operations that otherwise would not be done. But their program allows for donations, and they accumulate kind of the different staff to go on the different trips and to perform these operations free of charge to the people.
And we're gonna just transition now back to Liza to finish up the rest of the questions.
Yeah, so now we're going to take some questions from the audience submitted questions from the registration form. So thank you all so much who are in attendance for submitting questions. Our first one is, do you think that having a general surgery experience, so Dr. Lin, this is probably a little bit more directed towards you, is important to being well-rounded in the context of global surgery? Do you think that an I-6 program prepares you well for a career in global surgery?
You know, I obviously am biased because I specifically chose to go the longer route to get to where I want to get to. However, I will say that I think global surgery looks so different to many different people. And it sort of depends how you want to contribute and at what stage of your career and what your, you know, sort of interests lie, you know. So for example, when I was a medical student, people thought global surgery was ridiculous. It was a complete waste of time and money. And, you know, then in 2015, the Lancet Global Surgery published, you know, their Sentinel paper showing that basic surgical care is very cost effective, it saves lives, and it's critical to primary basic health care. You know, things like C-sections, hernias, those are all extremely important and give you a lot of DALYs for surgeries that you do. And so I think, you know, I think that if you want to be doing, you know, surgeries other than cardiothoracic surgery, then sure, you know, for example, I do foresee myself doing a lot of thoracic surgery and I think abdominal surgery. You just never know, I think, what you're going to find depending on what setting you're in. But, you know, you could also be involved in a program where you're just solely dedicated to cardiothoracic surgery. And so I think it just kind of depends on what you're interested in. I think my focus of spending the extra time was really to get myself research and dedicated time and a public health degree so that I would be a lot more attuned into public policy and policy sort of writing and that kind of thing, as opposed to just being dedicated to the operating room. And so I think that's why I decided to take the 2 years off, is I want to be involved in a little bit of the planning side of things as well. But I think you can, you know, all of us can contribute in our own way, whatever path that we choose.
I think it's an awesome question. I don't think Dr. Lin gives herself enough credit. I don't think that there are a lot of individuals who does what she does, not currently in a surgical training program, but who comes to mind, you know, Dominique Vervoet, someone who is in general surgery, who's probably done a decent amount of global health that comes to mind is Megan Klug from Johns Hopkins. There are not a ton of people who are in this subspecialty who have dedicated time in their training to doing global health. So it's a great opportunity that we're even having this discussion, that there seems to be a cohort of great individuals who have their eyes, you know, so high, so early in training. What I would say is that, as Dr. Lin also mentioned, that there's such a diversity in the different trainees and the different trainees in order to do this specialty. What I would say is just add 10 years, or let's say 15 years, to wherever we first started. The race that we're running is slightly different. We're talking about, you know, doing general surgery. And let's say you do general surgery, you do time off 1 or 2 years or 3 for global health, and then you do the 2 or 3 years of cardiothoracic surgery. You're 10 years in, let's say, and you're well trained. You're trained in cardiothoracic surgery. You've had experiences that no one else could amass because you've dedicated 2 years of time. And then you start your career off, you know, as a first year attending up to year 5, and that catches you up to year 15. The difference is that in 6 years training, I'm doing, let's say, a week, 2 weeks of dedicated time, you know, growing a program, building it, being a research coordinator at these sites, not doing 2 years of dedicated time. So understand that that is to be respected, but it's just a different thing. So by year 15, I would have been from year 7 to year 15 an attending cardiothoracic surgeon. When I get hired, I'm telling my boss and my teams that I'm dedicating, you know, this much time a month in doing my own operations at that location. By year 15, I'm independent and I'm building an opportunity. I'm building a hospital. I'm building a site. And I would have had 7 or 8 years, well, 15 minus 6 years of time to have done that. It looks different, but we're both contributing to global health. You just have to figure out, what is it, the route that you would like, the one that trains you extremely well with great opportunities, robust experience, or the one that kind of gets you out with all the tools. And as long as you have in your heart that this is what you want to do, you're going to get there. You either put the years in the beginning or you put your years in the end. No matter what time is moving forward, you'll have a different aspect of global health.
Great, thank you so much. We have another question, which is, what are your thoughts on the ability to increase access and assess the affordability for the need that exists currently? And what are the long-term goals of sustainability given the years of training to become a CT surgeon and the immense cost?
Yeah, I think that's a very important question. I think that, you know, when we talk about surgery and cost effectiveness, I mean, I had one of my friends tell me that, you know, if we're playing a numbers game, we lose as surgeons from the get-go. I mean, if we wanted to impact the most amount of people, then we would have, you know, been water engineers probably instead of doctors and surgeons, because we affect less change on a smaller amount of people. However, I think it's important that we are doing what we enjoy doing so that it lasts for a longer time. I have a lot of global health mentors that are general surgeons, trauma surgeons, and I considered it for a split second because I thought, you know, there's a very clear career path in global health as a general trauma surgeon. But, you know, ultimately I would have been pretty miserable if I didn't, you know, dedicate my time to cardiothoracic surgery. And I think it is very important to figure out what a community and a country requires and at what stage of healthcare they're at. You know, one of the things that we did with the Lancet Commission is look at hospital access in different countries. If you're looking at the Congo, you know, about 15% of their population is within 2 hours from a hospital. And so when you're looking at a country like that, it doesn't make sense to, you know, run in there and say, I'm a cardiothoracic surgeon and I'm going to do all these cases for your people, because what they really need is better roads and better infrastructure so their community can even get to a hospital. So I think, there are definitely places that will be ready for you as a cardiothoracic surgeon when you're done, and there will be places, unfortunately, that will still not be ready for you. And we have to be very cognizant of what the local communities are like and what their needs are, and whether they want someone to come in. When we go in and we do a lot of short-term mission trips, we sometimes can actually cause a problem for the local community because everybody's waiting for, the American surgeon to come and offer free surgery, and then they don't actually contribute to their local communities and their local surgeons who, have to charge them to feed themselves, right? So I think it is very important to understand the context. I still believe that there is definitely a need out there for cardiothoracic surgeons. I mean, if we have cardiothoracic surgery here in the US and we can offer the most advanced technology, then everywhere in the world deserves the exact same thing that we have. And so there's definitely a need out there. Maybe there's less of a need than trauma surgery, and there's less of a need for good water engineers, but there's a need out there. And I think if we all do our part in what we're good at, then we can all contribute, and make everything better. I know that sounds really cheesy, but I agree with you. We do need to do a good needs assessment, regardless of where we go, to make sure that they're ready for cardiac surgery and they want cardiac surgery, and they have the infrastructure to build around, the surgeon is the least important person when it comes to cardiothoracic surgery. You need the materials, you need the ORs, you need the nurses, you need, a place that even can do ICU care, which is very difficult. And so, surgery is just a very complex organism that needs a lot of support in order to be successful.
I guess in regards to access, everything that Dr. Lin says, I absolutely agree. In fact, there's ways for you to provide a resource and an opportunity that can actually cause harm. From the experiences that I've had with the CardioStart International enterprise, they were founded, back in 1987. And what they have done is they do a needs assessment. They actually fly out to the country of need. They actually, do an assessment of the people there, the needs that need to be had, the type of patients who are suffering from some of the illnesses that will otherwise cause, mortality. And they actually talk with the surgeons there about their capacity to take care of these patients and their ability to get these patients, discharged and back into their home, back into their homes, be it in the mountains and be it in different areas. And what they have found is that there is such a need for both primary care and both complex care. So the actual practice, at least with this institution and organization, which is why they've kind of been sustained for 30 years, is to provide both comprehensive mission trips where they're bringing echocardiologists, cardiac doctors who are trained in the use of an echocardiogram, where they actually go and for the entire day, they'll screen every single child at a school. They'll screen every single child that they can have access to, including adults, for rheumatic heart disease, for the sequela following congenital heart disease. And they've been able to catch and kind of be the first person to find a lot of comorbidities that essentially can be treated, because now they have had the opportunity to know in advance, that they're suffering from, some of these morbidities. With what they've done, they've gained a lot of partnership to kind of donate different supplies and medical opportunities. Those, unfortunately, if not given in the right circumstance, could be misappropriated or used incorrectly. So obviously, there is a whole assessment as for what's needed, how it can be used, and the better opportunities for using these things and sustaining it. But I think it all starts with a comprehensive dry run where you go, you assess the clinical practices, and you're teaching. That's the most important part. And this is all global health. It just so happens that we're in cardiothoracic surgery. But I can assure you, the entire time we're not operating. We're actually teaching. We're teaching the ICU doctors how to, find a certain pathology. We're teaching the medical students that are there who actually donate their time translating. We're teaching the surgeons there how to do these complex operations so that they can do it themselves. And we're also teaching from a program standpoint so that they can actually be able to sustain themselves both financially and by capability of the operations that are happening there. So there is just a great deal of scope and breadth to global health and to actually getting these programs up and running. It could be stressful, but at the same time, it's so rewarding. And what we also do at the end of the experience, we actually bring in people who were operated on a year prior, and they get their screening, they get their echocardiography to take a look, at their reconstructed heart, and they're so thankful. And you can see that they're now growing, an opportunity that if not given, they don't live, and that's where we are. But it's 100% correct. Not every single center is ready to have these resources. Not every single center has something that's sustainable. And to be honest with you, it's even possible that you can bring these medical equipment and supplies to a place that's not ready to receive it, and they would probably rather sell it for resources to actually live, such as food and water and stuff like that. Those are a different level of need. This complex operation opportunity may not necessarily be what they're ready for.
Great, thank you so much. So we have a little bit of a multifaceted question as one of our last ones. First, what are some specific challenges to the field of CT surgery and global surgery, which both of you touched?
Liza, you have cut out for me.
Yeah, I can't hear you, Liza.
Okay.
Oh,
Now it works.
hear me now?
Yes.
Okay, good. Sorry. So I was just saying that we have a multifaceted final question. This one is, first, what are some challenges specific to the field of CT surgery within global surgery, which both of you just touched on, but if you have anything else to add. Likewise, how can a medical student specifically get involved in global cardiac surgery? And then finally, what are your thoughts on doing a global health research fellowship program as a med student as opposed to later in a residency program? And what does global health work and policy and cardiothoracic look like? So a lot going on. Please let me know if I can break it down for either of you.
Well, to take the part of opportunities for the medical student, I'll give an example. There are multiple organizations that give opportunities for individuals to volunteer in cardiac surgery in the way that I have described, right? Specifically, not having a board certification in something, it would be doing research coordination, documenting the operations and maintaining a database for research perspectives. Useful because those same patients, you are acquiring information so that you can do better, so that you can actually screen the opportunities you've done, the operations you've done, how useful, how do they do, should we do it a different way, was this patient ready? You're getting all of their data and kind of putting it together. For the medical student, that is possible. Now, it does require some level of knowledge in regards to operations being familiar, but there is no certification requirement of sorts. So you can be a research coordinator, and what comes to mind is CardioStart as an opportunity. Some of the other ones, you have to be board certified in something, and obviously a medical student wouldn't be. But believe it or not, there are also different attendings who do mission trips that are more so private, not big operations, big opportunities. There are also private people who actually go and donate their time in a structured method. They're just not going with 20 people from one organization. I would say by checking your local hospital and seeing who at all believes in global health, because again, global health looks different for different people, and different people have different opportunities, different resources, and different perspectives. So I would say in regards to getting an opportunity, that would be it. Dr. Lim could probably speak better to the opportunities that are more long structured, like year opportunities to get a ton of additional skill sets.
Yeah, I think that I fully agree with Clauden. There is so much that you can do at every stage of your career. You know, as an undergrad, as a medical student, as a resident, now as a fellow, I've done very different roles each time. And I think I'm hearing a need from a lot of these questions that you guys want to know what the opportunities are. And maybe that's something that I can work on with Clauden, is to make them, to sort of put them all together, so to make it easier for people to find these opportunities. But I think there are a lot of established cardiothoracic programs, and Clauden has mentioned a few of them, where if you're interested in the these mission trips, that you can participate. There are a few research fellowships out there that you can participate in as well. I think, Liza, can you repeat the last part of that question? I think I had something to add, but I can't remember what the last part of that question was.
Yes, of course. The last part of the question was, do you have any thoughts on doing a research fellowship during medical school versus as like post-medical school as a resident?
Gotcha. Yes, and I have a feeling Clauden and I will have different ideas on this, because you can tell from the routes that we take that he is of the thinking that the faster he finishes his fellowship, then he'll be able to contribute as a fully board certified surgeon and have more years in that role. And for myself, I started medical school actually pretty early when I was 20, and had done college sort of really quickly and tried to get everything done very quickly, and kind of took a step back and said, actually there are a lot of opportunities again at different levels that I wish I would have taken advantage of. So I think that's a very individualized question, depending on the resources you have, depending on what stage of life you're at, and what your family situation is. I think at any point there will be a great opportunity for you to participate in global health. I'm of the feeling that the more opportunities you have early on, then the better opportunities you will have in the future. So I don't think that it's wrong to do it anyway. I will say that if you do decide to take time off, it's very important that you find it early and you make sure that it's structured, because there are a lot of people out there who want to do a global health year, but it's very, very difficult to get these projects, underway and productive, as you can imagine. I mean, doing a research project in the US is difficult. Now you're in a different setting where, the IRB system is totally different, and, you have to get used to the culture. You actually have to, talk to the stakeholders on the ground who you may not understand what the community needs. And so it's just infinitely more difficult. And so you need to make sure that you're integrated with good mentors. You have, something solid that you're going to partake in, because otherwise it could potentially be a complete wasted year. I will say one of the things that I get asked a lot from the medical students is whether they should do their MPH as a med student, as a resident. And my feeling, and this, is definitely not for everybody, is that it's probably more worth it to spend time doing the research component and the clinical component as a med student, as opposed to getting a public health degree, because a lot of your programs, it's a year of an MPH, but you have no time to do anything else but study. And it's hard to apply that knowledge because you don't have any, time to actually use it in the field. Whereas, as a resident, I have a lot more context. I knew exactly how I wanted to structure my public health degree so that it was going to be very useful to me in the field. And then also, I think what's important is that it's very easy to find opportunities to get your MPH paid for as a resident, as opposed to a medical student. I think it's also, a lot of opportunity cost. But that's just my personal feeling about that.
Great. And then if you just have a last minute thought on what the role of public health policy is in terms of global health and CT surgery. That was actually the last part of my extremely long question.
Yeah, I'll continue, and I'm sure Clauden also has a lot of thoughts on this. And I think it's critical that we as surgeons get into the public health domain, because a lot of these public health professionals are people that don't actually work directly with patients. So they may not understand all these intricacies that are so critical for our patients to do well. You know, you can do a cardiac surgery perfectly, 100% beautiful, amazing cross clamp times, patient comes out perfect, but they could die a month later because they didn't get the warfarin, because they, you know, didn't have money to buy warfarin, or they weren't able to check the INR at the local, you know, facility because it's not open every day, and they just didn't get to do a follow-up. And so if you want a successful surgery, there is just so much more than just the operation itself. The operation itself, like I said before, is probably the easiest part of the whole endeavor. So I think that for the longest time, we as surgeons have been shying away from it because we love being in the OR. I mean, if you will ask me if I wanted to be in the OR versus, you know, in an MOH meeting, there's no question, you know, I would want to be in the OR instead of another meeting with the Ministry of Health. But if we don't involve ourselves, I don't think we can do truly good, sustainable surgery that involves the whole community and is, you know, there after we leave. So I think that that is a very important point. And even if you aren't an expert in it, you need to make sure that you have a team member who is. And it's always good to involve yourself, because you as the surgeon, you know best, I think, what your patients need.
And due to the lack of time, I just want to ask the final question, and we'll make it very brief. I think a lot of students here, including myself, we look at Yihan and Clauden as possible place that we want to be eventually in the future, either whether it's in global CT surgery, whether it's in the I6 program, or having done different fellowships. So now that you're at this place, what advice would you give your fellow self as a medical student that eases either anxiety, that helps us kind of become more prepared to be where you guys are at and become more successful?
Well, I would probably say you can do whatever it is that you want, whatever route that you would like. Usually, there are no necessarily predefined routes that are restrictive to you, that it's the only way that you can do things. When I look back at my track record, or back at my path to where I am right now, it was not in a straight line at all. There weren't things that were guaranteed anything. I didn't know I was going to be in an integrated program, that I was going to be one of 36 people to match in year 2016. Although it's a great opportunity, I did not know, but I did not restrict myself. I definitely still applied, whereas other people probably may have been interested. They probably said, no, it's too difficult, or it's too hard, or there's not enough seats. I think that there is an opportunity for all of us to be great in different ways, and I take that same exact path in regards to global health perspective. There are opportunities for us to contribute at any level. So if you're saying, hey, should I do a program now? Should I do a program later? To be honest with you, I have many interests. I'm interested in ethics as well, and if I did a program in ethics when I was a medical student, although I wouldn't have the context as I do now following medical school, now in residency, then I'd probably be more proficient at it now. But that would take away from the other things that filled that gap. There's always going to be something that you can do or could have done prior. I think that if global health is kind of, the route that you want to do, and for a fact that it's going to be your main focus, you are not cheating on it with other things, then yeah, I would agree that you should go committed and full-hearted, with that earlier. If you are interested in more than one things, for me, I'm interested in ethics. I'm interested in innovative cardiothoracic surgery. I'm interested in creating and the engineering concepts behind those things. I would like to help. It's going to look different because I want to create an infrastructure. I want to create an opportunity. I want to create a business, a program. You know, my method of helping is going to be a little bit different. And I think there will always be different people that's going to help answer this question. How do I get there? Well, it's going to look different, and it's not in a straight line. You just keep pushing forward.
Great. I don't know if I was supposed to also say something to that question, but I agree with Clauden. You know, I think it's very stressful to be a medical student and not know what the next path is. But I think there are so many opportunities now for you to get to where you want to be, and so long as you know you're willing to put in the time, you'll get there eventually. They're just different ways, and so at any time, I think you can integrate yourself. And so don't be discouraged if it doesn't happen the first time either. You know, there's going to be other opportunities out there, and I know it's really difficult to be a medical student and then have to, you know, think about all these things, but they will come together eventually. I mean, this is me, you know, 14 years after medical school started, or 13 years, and I'm very happy at sort of the way things have turned out.
Well, thank you all for your time, and thank you for all the attendees. I know we went slightly over time, but these were such great words of advice that we couldn't skip out. So tune in to the follow-up email of feedback forms and of our following GSSA webinar series. And thank you, Yihan. Thank you, Clauden. Hope you all have a good night.
Take care, guys.
Bye.
Night. Thanks, guys.